My name is Anne Henderson. I'm a consultant gynaecologist and obstetrician working at KIMS Hospital in Kent. The BRCA gene is a very important gene within the body. It has a specific role in suppressing the growth of malignant tumours, which are effectively cancerous. In those individuals who have a BRCA mutation, whether that's BRCA1 or BRCA2, those genes are then faulty, which leads to an increased risk of developing certain types of malignancy and other associated conditions. The BRCA gene can be inherited from either parent, and it carries significance in women because it can be associated with an increased risk of both breast and ovarian cancer. It does not account for large numbers overall. Probably about 5% of the total number of breast cancer cases in the UK have a BRCA link, slightly more ovarian cancer cases, probably in the region of 10 to 15% of the total number of diagnoses. The background risk of breast cancer in the UK at the moment is in the region of 12%, but less than 2% of women will develop ovarian cancer, so it's a much rarer disease. If the patient suffers from a BRCA mutation, regardless of whether it's BRCA1 or 2, the risk of breast cancer is substantially increased from 12% to between 50 and 85%. So that is a significant rise. As far as ovarian cancer is concerned, the risk is slightly less, thought to be in the region of 25 to 50%. And there is some variation depending on whether the patient has either the BRCA1 or BRCA2 mutation. In addition to breast and ovarian cancer, the mutations can be associated with other illnesses, including bowel-related cancers, pancreatic cancers, and certain types of anemia. As far as men are concerned, if they have inherited the gene, they are also at risk of a particularly aggressive form of prostate cancer. One of the common questions that we're often asked is who should be tested? And clearly it doesn't affect large numbers of women, so it's not appropriate to test everyone who has a history of either breast or ovarian cancer in the family. Testing is not offered to everyone, and there have to be specific risk factors in the history which will then lead on to testing for either the BRCA1 or BRCA2 gene. The sort of history that we would look for is early onset breast or ovarian cancer, for example, 2 female relatives affected by breast cancer at under the age of 50, or 2 relatives affected with ovarian cancer at any age, or a single female relative affected by both breast and ovarian disease. There is also known to be an increased risk in those people who have Ashkenazi Jewish ancestry, so taking a detailed family history can be very helpful. Through my interest in menopause and HRT, I've developed very close links with the local BRCA support group. I attend as many monthly support groups as I can to help answer queries that the women may have, both medical and otherwise, and I also help organise the biannual support group, which is offered to both healthcare professionals and patients alike. One of the most difficult points faced by BRCA carriers is that they may inevitably have to go through a premature surgical menopause when they have either ovaries or both ovaries and womb removed. And that is where the Kent Menopause and HRT Clinic can play a huge role. We're there to offer state-of-the-art care, offer treatments, diagnostic procedures, and link in with all the allied specialties that these women may need to see, including breast services and gynae-oncology services. KIMS is able to offer BRCA sufferers state-of-the-art treatments and diagnostic options in a fantastic setting. If you feel that any of this information applies to you, please don't suffer in silence. We are here to help.